Hello everyone. The present day's respiratory problems like asthma, pneumonia, and others are increasing. And the most of the people don't know how to use meter dose inhaler and nebulizer. So I am here to discuss what is the proper method of using nebulizer and MDI inhaler. More than 12 years, like any child or any adult, they can use MDI inhaler directly. Then how to use? Remove the cap of MDI and shake inhaler in vertical direction. Ask the child or person to breathe out gently. Then put mouthpiece in the mouth. At the start of inspiration, press the canister and continue to inhale deeply. Hold breath for 10 seconds or as long as possible. Then breathe out slowly. Wait for a minute, then do it one more time. But the persons or any child who are less than 12 years, they don't have coordination between pressing the canister, that's actuation, and the inspiration. So for less than 4 to 5 years child, you should use MDI inhaler, spacer, and mask. How to? Attach baby mask and inhaler to spacer device. Cover baby mouth and nose with baby mask. Press canister and encourage child to take breath with mouth open for 5 to 10 times. Remove baby mask and wait for a minute. Repeat one more time. For children more than 4 to 5 years, use MDI inhaler with spacer. Then how to use? Remove the cap. As usual, shake inhaler and insert into spacer device. Place the mouthpiece in mouth. Start breathing in and out. Once breathing pattern is established, press canister and continue to breathe for 5 to 10 times. And you can do it, others do it for 50 to 30 seconds. Remove the device from the mouth and wait for a minute. Do it one more time. So this one is the method of using inhaler device. But for any persons and any children, you can use nebulizer device. How to use nebulizer device? Connect compressor machine with nebulizer chamber by tubing. Add 2 ml of normal saline with advised dose of medicine like salbutamol or budesonide. Switch on the machine. Look for gas, means aerosol coming or not. Then attach the face mask to child. Ensure it is covered nose and mouth of the child. Encourage child to take breathing with mouth open. How do you know whether the canister inhaler have gas or not? So when the gas inhaler is the new one, it has the gas like salbutamol or budesonide. It will sink in the water, and when the inhaler it is empty, it will float in the water. If you don't get spacer device, you can use water bottle by cutting and heating the ends of the bottle. But the disadvantage is it doesn't have a valve, so that there is a chances there is mixing up inhale and exhale air. Inhale and exhale air. The next question is how to clean the spacer and inhaler device. Like inhaler device, how to cover means you open the canister, the metal part of the canister, and wash this one with running water and put and dry this one. Okay. But thing is, when you are washing, you should, according to IFP, they advise to wash this spacer and mask with once in a month. So this device you wash with the lukewarm water, but when you are drying, don't use a cloth. Allow it to deep dry. Okay, allow it to deep dry. Don't use the cloth while you are drying. When you are using this one, this one blue color with that salbutamol, for that no need to wash the mouth after every use. But the thing is, you should once you keep it pink color or any corticosteroid, then you have to wash the mouth at least from the